Hello, everyone. Welcome to the Health is in Your Hands channel. Today, we are going to explore some of the very common treatments for dry cough. But before that, let us understand what dry cough is. A cough is nothing but a reflex action that clears your airway of irritants and mucus. There are two types of cough, productive and non-productive. A productive cough produces phlegm or mucus, clearing it from the lungs, whereas a non-productive cough doesn't produce phlegm or mucus. This non-productive cough is commonly known as dry cough. Now let's see what the common causes of dry cough are. Airway hyperresponsiveness is one of the most common causes of dry cough. Other than that, there are GERD, post-nasal drip, and viral infections, which can also cause dry cough. There are many other less common causes like environmental irritants, ACE inhibitors, whooping cough, collapsed lung, lung cancer, and heart failure. Now talking about the treatment for dry cough. The first thing you should try for a dry cough is honey. Honey has antibacterial and wound-healing properties. It can also help coat the throat, reducing irritation, pain, and inflammation. So it is very useful for both daytime and nighttime cough. You can try taking honey by the teaspoon several times a day or adding it to tea or warm water to drink. However, remember never to give honey to a child under 1 year old, as it can cause a rare complication called infant botulism or floppy baby syndrome due to the ingestion of bacterial toxins that may be present in honey. Honey is harmless for other children and adults. The next thing you should consider is warm saltwater gargling. Gargling with warm salt water is one of the simplest and most effective home remedies. The salt helps to pull out mucus from your swollen and inflamed tissues, relieving discomfort and a scratchy throat. Add about a ½ teaspoon of salt to lukewarm water and gargle several times a day. Turn on a cool mist humidifier to increase the moisture in your room. If you don't have a humidifier, you can still get relief by taking a hot shower. The steam from a warm shower loosens mucus and can moisturize and soothe your sore throat. You can also take steam from hot water in any container. Ginger is very beneficial for dry cough. It can suppress the cough flex by relaxing the smooth muscles of the airways. Ginger also has antibacterial and anti-inflammatory properties, relieving pain and discomfort. Studies have reported that gingerol, a chemical compound in fresh ginger, can suppress airway inflammation that can trigger symptoms of asthma, including cough. Ginger can be found in many teas as an ingredient. Or you can make ginger tea from ginger root by steeping the peeled or cut root in warm water. Adding honey may make it even more beneficial for dry cough. However, remember that consuming too much ginger may cause stomach upset, heartburn, or diarrhea. The next remedy we'll discuss is thyme. It contains a compound called thymol that is believed to have antispasmodic effects, helping to relax the smooth muscles of the throat. Thyme is safe for occasional use only. You can make thyme tea by infusing 3 to 4 teaspoons of the dried herb in 250 ml of boiling water. You can add honey for added cough-relieving benefits, but avoid consuming thyme essential oil, as it can cause a potentially serious drop in blood pressure. Marshmallow is a type of herb used in cough syrup and lozenges to soothe dry cough. A study found that it's an effective treatment for soothing the throat and reducing the irritation caused by dry cough. Marshmallow roots also have antibacterial properties. Peppermint contains menthol, which helps numb nerve endings in the throat that become irritated by coughing, providing pain relief and reducing the urge to cough. Peppermint also helps reduce congestion. You can take peppermint lozenges or peppermint tea. If you are dealing with nighttime cough, drinking peppermint tea right before bedtime can be very helpful. Antitussive medications work by reducing the cough reflex, lessening the desire to cough, which is especially beneficial for dry cough. Some antitussives contain codeine and are available by prescription only, while other over-the-counter medications typically contain active ingredients such as dextromethorphan, camphor, or menthol. Dextromethorphan is a cough suppressant that affects the signals in the brain that trigger the cough flex. However, note that dextromethorphan will not treat coughs caused by smoking, asthma, or emphysema. So dry cough can be annoying, especially when it seems to persist for a long time. If you're not sure what's causing it, consult your doctor to figure out the best course of treatment. In the meantime, a combination of home remedies and over-the-counter medications can provide some relief. For more informative videos, please subscribe to our channel. Thank you.